Have you ever felt that your erections just aren't what they used to be? It's a harsh reality many men over 60 face in silence, often blaming it on aging or stress. But here's the shocking truth. The real culprit may be a hidden deficiency in just three vital nutrients: vitamin D3, B12, and B1. These are the components your body desperately needs, but struggles to absorb as you grow older, silently chipping away at your confidence, your energy, and the intimacy you deserve. I'm Dr. Mohit Kara, a men's health specialist with over 30 years of experience helping men reclaim strength and vitality, and I've witnessed firsthand how these deficiencies can derail sexual health. The good news? Correcting them is natural, safe, and surprisingly easy once you know how. Let's start with vitamin D3, often called the master switch for muscle and vascular health. When I first began working with men over 60, I noticed a recurring pattern: weakness, fatigue, and yes, struggles with erections that once felt effortless. While many assumed low testosterone was the cause, the real issue lay in deficient vitamin D3 levels. This nutrient acts as a conductor for a complex orchestra. It strengthens blood vessel walls, supports muscle contraction, and facilitates nerve signal transmission. Without adequate D3, blood vessels lose flexibility, muscles weaken, and nerve communication stutters. That combination makes achieving and sustaining an erection far more difficult. As skin thins with age and nutrient conversion in the liver and kidneys slows, even spending time outside often isn't enough to maintain sufficient vitamin D3. I've had many patients who discover their muscle weakness, balance issues, and erectile struggles stemmed from this deficiency. After supplementing, typically between 800 and 2,000 IU daily, they experienced measurable strength gains and firmer erections. Higher vitamin D3 also helps quell chronic inflammation by protecting artery linings, promoting smoother blood flow and better sexual function. When combined with a healthy diet and sunshine exposure, supplementing D3 can be the first step toward reclaiming your vitality and confidence. But healthy blood vessels and muscles are only part of the picture. Your nervous system plays an equally critical role, and that's where vitamin B12 comes in. Often called the communication booster, B12 ensures your brain's commands reach their destination quickly and clearly. It's vital for producing myelin, the protective sheath around nerve fibers. Without enough B12, nerve signals become weak or erratic, and that can lead to numbness, tingling, and frustrating sexual performance issues. What surprises many men is how common B12 deficiency is after 60. As your stomach produces less acid and medications like proton pump inhibitors interfere with absorption, you may face moderate to severe deficiencies while feeling only vague fatigue or brain fog. I remember a patient in his late 60s who was losing his footing and noticed weaker erections. Testing revealed dangerously low B12 levels, and within weeks of daily methylcobalamin supplementation, not only did his erection quality improve, but his balance and energy returned. B12 also boosts red blood cell production, improving oxygen delivery to muscles and organs. With better blood oxygenation, your body's endurance improves, and that includes your sexual stamina. Taking B12 midday, in a form your body can use immediately, ensures it supports your nervous system without interrupting sleep. But you also need the energy to fuel your muscles, especially the ones involved in erections and sexual performance. That's where vitamin B1 thiamine acts like the spark plug. Thiamine helps convert carbohydrates into ATP, the energy currency of your cells. Without it, your muscles and nerves become sluggish. This becomes noticeable over time as fatigue, cramping, or a dimming of intimacy. After 60, natural thiamine absorption declines, and factors like poor diet, alcohol, or certain medications aggravate the issue. Consider the man who struggles to climb stairs or feels exhausted after minimal activity. Thiamine deficiency is often the hidden block. Studies have shown that restoring thiamine improves muscle endurance and vitality, bringing back energy levels and, yes, restoring sexual performance. The recommended daily amount for men over 60 is around 1.2 mg, preferably taken with a morning meal that includes protein or healthy fats to aid absorption. This small change can spark significant transformation, lighting up your day with renewed physical and sexual energy. Now, let me show you how these three vital vitamins work as a powerful team. Think of your body as a complex machine that needs structure, communication, and fuel to run at full capacity. Vitamin D3 strengthens muscles and blood vessels, building the foundation. Vitamin B12 ensures nerves transmit signals swiftly and accurately, restoring your internal communication system. Vitamin B1 fuels the muscles with energy, activating the performance you've been missing. When all three are in balance, they don't just work side by side, their effects amplify one another. Improved circulation delivers more oxygen, which fuels muscles. Stronger nerve signaling enhances coordination, and energized muscles perform within a supportive vascular and nervous environment. That synergy is what leads to visible improvements in confidence, energy, and sexual function. No miracles and no gimmicks, just biology working the way it's meant to. You may be wondering, how do you confidently implement this routine? In part 2, I'll share a simple daily regimen you can start tomorrow, with recommended dosages, best timing, and crucial safety guidelines. We'll also dive into how to monitor your levels to avoid over or under supplementing, and how to combine these nutrients with healthy lifestyle habits, nutrition, exercise, rest, to maximize results. I'll also share real success stories from men who've regained erections, energy, and emotional connection after decades of frustration. If you're ready to reclaim your vitality after 60, Part 2 will give you the practical playbook to make that happen, starting today. Now that you understand the powerful role vitamin D3, B12, and B1 play in restoring erections and vitality after 60, let's talk about how to bring these tools into your daily life in a way that's simple, effective, and sustainable. Because knowing which vitamins you need is one thing. Using them safely and consistently is what truly unlocks their full potential. I've seen firsthand how following the right regimen doesn't just improve physical health, but transforms a man's confidence, mood, and even relationships. So, let's break it down into a routine that you can implement starting tomorrow. Let's begin with vitamin D3, your morning foundation. Since D3 is fat-soluble, it should be taken with a meal that includes healthy fats. Think eggs, avocado, or even a small drizzle of olive oil. Morning or early afternoon is the best time, as taking it late can disrupt your sleep cycle. The dosage depends on your individual needs, but for most men over 60, a daily dose between 800 to 2000 IU is both safe and effective. If your doctor confirms a deficiency, you might need a higher dose temporarily, but always under supervision. What many men don't realize is that food alone rarely provides enough D3. Salmon, mackerel, fortified milk, they help, but the levels just aren't enough to counter age-related decline. That's why this simple addition to your breakfast is such a game changer. It supports your entire vascular and muscular system before you even leave the house. Then comes vitamin B12, your midday alertness and nerve signal booster. Ideally, take this as a methylcobalamin supplement, the form your body can use immediately. Choose a sublingual tablet or a lozenge that dissolves under the tongue for best absorption. I usually recommend 500 to 1,000 micrograms daily, taken with lunch or shortly after. Why midday? Because B12 can increase alertness and energy. Taking it too late in the day might keep you up at night. It's especially important to take it away from caffeine or tea, since those can interfere with how your body absorbs it. And don't worry, B12 is water-soluble, so your body eliminates any excess. Still, regular monitoring through blood work ensures you're hitting the sweet spot. For many of my patients, the first thing they notice after just a week or two of consistent B12 is clearer thinking and faster physical response. Then, often without warning, they start waking up with morning erections again. That's not coincidence. It's your nervous system reactivating and doing what it was built to do. The final piece of your daily supplement puzzle is vitamin B1, or thiamine. This should be taken in the morning, ideally with your D3, but also with some protein and healthy fat for better absorption. A dose of 1.2 milligrams per day is standard for men over 60, but higher doses might be recommended if you've had symptoms like fatigue, cramping, or difficulty with endurance. The key with B1 is consistency. It fuels your muscles and supports both nerve and brain function, so missing it for a few days can undo some of your progress. When patients tell me they suddenly feel less tired climbing stairs or that their legs feel stronger, it's usually because their cells are finally producing energy efficiently again. That stamina? It extends into the bedroom too. You'll notice your muscles don't fatigue as quickly, and that feeling of not being able to keep up begins to fade away. Now, let's talk about synergy, because when these three vitamins are taken together, the effects multiply. Vitamin D3 supports the blood vessels and muscle structure. B12 makes sure your brain and nerves communicate effectively. B1 gives your muscles the power they need to respond. When one is missing, the system struggles. When all three are working together, results can be profound and fast. I've seen men regain morning wood after just 10 days. I've seen couples reconnect emotionally after months of distance. And I've seen tears of joy when a man who thought his intimate life was over experiences that first strong, spontaneous erection in years. This is the reality of proper supplementation. It's not about hype, it's about science working as intended. But I want to be clear, this is not a magic bullet. While vitamins provide the biochemical support your body needs, your lifestyle determines how effectively they work. That's why I always recommend a few essential habits to pair with your vitamin routine. Regular movement, daily walks, light strength training, or stretching improve blood flow and maintain muscle tone, reinforcing everything your vitamins are doing on the inside. Stay hydrated. Dehydration thickens your blood and reduces nutrient transport. Start your day with a full glass of water, especially before any supplements. Prioritize quality sleep. Your body repairs and balances hormones during deep sleep. Poor sleep disrupts testosterone and reduces the effectiveness of your entire system. Limit processed sugar and alcohol. Both deplete vitamins and contribute to inflammation, the silent killer of performance and vitality. Manage stress. Chronic stress raises cortisol, which competes with testosterone and exhausts your nervous system. Simple breathing exercises, mindfulness, or even a short nature walk can help. These habits don't need to be perfect. They just need to be consistent. Supplements aren't a replacement for a healthy lifestyle. They're a support system to help you make the most of it. Now, I want to share a few real stories that show what's possible when men commit to this journey. George, 68, had struggled with weak erections and balance issues for nearly a decade. After testing, we found low D3 and B12. Within a month of beginning a tailored regimen, he regained not only balance, but also intimacy with his wife. His words still echo in my mind. I didn't think I'd ever feel like a man again. Or James, 72, who couldn't make it up a flight of stairs without stopping. His thiamine levels were critically low. 3 weeks of supplementation combined with daily walks, and he was climbing stairs with ease and smiling again. These transformations aren't rare. They happen every day when we treat deficiencies as the root cause, not just the symptoms. Before we close, let me stress the importance of doing this safely. Always consult with your doctor, especially if you're on medications for blood pressure, diabetes, or other chronic conditions. Get your vitamin levels tested. It's a simple blood draw but can guide you to the right dosages and prevent oversupplementation. And remember, just because something is natural doesn't mean it's without risk. Respect the process, listen to your body, and adjust accordingly. Finally, I want you to envision what's waiting for you if you start this journey today. Imagine waking up with more energy, clearer focus, and the confidence to initiate intimacy without fear or hesitation. Imagine not feeling like age is a sentence, but rather a season where strength and connection are still possible, where passion still lives. That vision isn't just hopeful. It's real. It's possible. And it starts with 3 simple steps. Take your vitamins, move your body, and care for your mind. Thank you for taking the time to watch and reflect. If this video inspired you, hit the like button, subscribe, and share it with a friend who might need it. We're all in this together, and your journey might just inspire someone else to take the first step too. And if you'd like to support this mission of bringing real, honest men's health advice to more people, consider leaving a comment, sharing your story.